Dr. Joseph Varon.
El Dr. Joseph Varon.
Dr. Joseph Varon worked his 365th day in a row.
I worked 715 continuous days, nonstop.
Is that the hardest time of your life?
Part of me says, this is what I was made for. If I could go back in time, I would not vaccinate a single person. I personally don't think that it made a difference. The moment I said, these vaccinations are probably not the right thing to do, Houston Chronicle puts a whole page thing, oh, Varon is the worst, he's the leader of a cult or something like that. I mean, it's like, come on, guys. I'm seeing the real pandemic. More than 50% of what I see in my practice now is vaccine-related injuries. There are some things that you have to do because you feel that they are the right things that you have to do.
Breathing is the one thing you can't negotiate with. In the last few years, we've watched respiratory health become the front line of modern medicine, from COPD and asthma to the ICU reality of COVID, and everything it exposed about preparedness, prevention, and public trust. Today, I'm joined by Dr. Joseph Varon, pulmonologist and critical care physician here in Houston, to talk about the state of lung health and what we're still getting wrong and how medicine has evolved for this doctor. What does better actually look like when the organ at stake is the one that keeps you alive minute to minute? Well, Dr. Varon, thank you for coming.
Thank you for having me.
I'm very excited about this conversation. You've lived an incredible life, and I want the world to know, and especially I want to know some things. So we'll start from the beginning. You grew up in a medical family, right?
Actually, no. Actually, believe it or not, I was the only one in my family that became a doctor.
Okay.
My father immigrated from Turkey to Mexico. And unfortunately, this was after the Second World War.
Sure.
And he could not complete college. So for him, the most important thing was that all his kids had some kind of education. Interestingly enough, he pushed us all, but I didn't know what I wanted to be. I mean, I had no clue what I wanted to be. So on my last year of high school in Mexico, you have to decide what area you're going to go into, whether you're going to chemical, biological, math, social sciences, or stuff like that. So my dad takes me to one of these psychologists that do aptitude testing. Within 2 days, the aptitude testing lady calls my dad and says, sorry, Mr. Varon, I'm not going to be able to charge you. Says, why? Because says, I don't have an answer for you. Your son scored well on everything, so he can get into whatever he wants. So there you have me, still not knowing what to do. So I tell the lady, so what shall I do? She says, well, get into something difficult or challenging. Chemical biological area is one of those. On my last day of high school, and remember, in Mexico, you go from high school to med school directly. On my last day of high school, we go to my graduation ceremony, and all my friends already know where they're going. I have no clue. In my graduation dinner, I sit next to my best friend and his dad is a doctor. And he tells me, Joe, what are you going to do with your life? I said, I don't know. He looks at me and says, why don't you become a doctor? I said, great idea. And that's how I became a doctor.
So then why ICU?
Because I like challenges. I mean, I like the difficult challenges. And that's very interesting because, during COVID, that was like, I was in my element. I was in an area that I had a challenge. I had to find ways to fix it. And I've always liked the excitement of critical care. I mean, yes, I did the other specialties, the internal medicine, the pulmonary, and all the other ones that I have. But either intensive care or emergency medicine have always been my babies. I mean, I love that stuff.
Are you addicted to the adrenaline, perhaps?
I think that I'm an adrenaline junkie. I accept it. I mean, which is fascinating because when you've been in multiple cardiac arrest situations where you go in and everybody's screaming and stuff like that. I'm the calmest guy on that things. I have actually even measured my own pulse rate during those situations, and I'm super relaxed. I mean, I feel comfortable. Things that make me comfortable are caring for the critically ill and writing. I love to write.
So you're like Tom Brady, last seconds of the game, you're just zoned in. And
I'm just zoned in and I'm zoned in. I'm so calm. I mean, I can't understand why everybody freaks out. It's like, wait, what if we cannot do this? We find a way. And that has always been something that has fascinated me.
So then how did you come to Houston? You eventually got here, right?
So, I finished med school, then I come to the U.S. And,
American dream kind of a thing?
Yeah, it was kind of like, I started in Spain. I did a little bit of cardiovascular surgery in Spain. And I said, no, this is just being an operator. I need something that has a little more brains. So I come to Houston. I applied to 800 programs.
That must have cost you something.
Well, I mean, at the time,
it was free.
It was free, and it cost me because you have to send you have to send them a letter. No emails. So we send letters, and I sent my CV. My CV at the time was only 12 pages.
How many pages is it now?
340.
Not bad.
Yeah. So, but it's 12 pages. So you can imagine printing 12 pages for 800 programs. I had one of those Daisy Wheel printers that was. I used to live in Houston, and Sarah and I would go to Galveston for the day and then come back, and the printer was still doing. So I write to 800 places. From 800 places, only 80 reply. And those 80 say, sorry, you are a foreign medical graduate. We don't take foreign medical graduates. So now it's July 2nd, and Sarah is pregnant. And I'm like, you know what? I'm heading back to Mexico, man. So I get this phone call from this guy in D.C., from George Washington University Hospital, Providence Hospital. Dr. Varon, are you still interested in doing residency? Yes. Well, we have an unexpected opening. When can you come for an interview? Tomorrow. So I fly in, and they says, when can you start? I said, let me go to Houston, and I'll be back in 3 days. So I fly back to Houston. We rent one of these rider trucks. I put the wife, the dogs, the furniture, and we start driving to DC. We get to DC, and, you know, we lived in a motel for a while. We didn't have a place, stuff like that. And my first rotation was ICU. So I started doing ICU, and the chief of ICU says, Joe, what are you doing here? Says, what do you mean, what am I doing here? Says, this is a community hospital. I mean, why aren't you on the big leagues? I've seen your CV. I said, well, they didn't take me. Says, Joe, apply again. What do you mean apply again? Yeah, you apply again. I said, no, I don't want to apply again. So he convinced me to apply. So I applied to Harvard, Stanford, Mayo, UCSD, and UCLA. Without an interview, the 5 of them says, when can you start? And there was nothing different on my CV other than I had already started in the US. Same score, same everything. Nothing had changed. I got a big map on my wall. I got a dart because I didn't know where to go. I threw the dart. I said, wherever it lands, that's where I'm going. It ended up in California, Northern California. So I said, Stanford it is.
Not a bad place.
No, but which was an interesting place. I mean, I won the Resident of the Year award year after year after year. And it's interesting because, you know, I was the only foreign medical graduate there. All my colleagues and friends were from, you know, either Stanford or Mayo, or they came from whatever. But I was very productive.
Did you have to work harder, did you feel?
No, I mean, I worked my own way. So, for example, when we were on call, it was an easy night. I was at the library writing a paper, finding out stuff, you know, trying to get things going, learning. Whereas my colleagues were resting or doing other things. That was their way. So that's why I got so excited. The reason why I moved from there to Houston again is we were in the earthquake in San Francisco, and Sarah is deadly afraid of tremors, just because we were in the one in Mexico City. She saw how one of the buildings fell and stuff like that. So she says, no. So when it was time to apply for fellowship, I said, hey, I'm going to go to Houston. Houston is a big place, you know, great program, Baylor College of Medicine. Why not? And that's how I moved back. And as soon as I finished my clinical training, my very first job was to be the chief of intensive care at MD Anderson. And it was great. It was, you know, I call it my big lab. That's where I was able to do a lot of things, but I was working for the government. And anybody who has worked for the government knows that that's not the way to do things. So after 3 years, I decided to go into private practice while maintaining my academic affiliations.
So what year was that?
That's 1997. I worked in emergency medicine. I ran the ER at Methodist for about 5 years. And while I was doing my shift, you have no idea how much I would work. I would do like a 6 p.m. to 6 a.m. night shift in the ER. And then I would go see my patients that I had in the hospital. Then I would go to my office, see patients in the office. I would go home, sleep for 2 hours, and do it all over again.
So you just don't need sleep? Are you one of those 1 to 3% of people that has that gene?
Correct. I have that gene without. I've never tested it, but I know I have it. I can get away with an hour and a half. My average night is no more than 3 to 4 hours.
Did your kids inherit this?
No, they sleep like rocks. And so does my wife.
So at that time, probably HIV was roaring, I think, right? There was a crisis. Was that one of your first crises?
The first crisis, I mean, I got to see my very first patient with HIV. I saw it in medical school. And, they had this guy way up in a ward where nobody would get close to him. It was like, my first crisis as such was the earthquake in Mexico City. Earthquake in Mexico City that killed a bunch of people. I mean, I spent countless days or hours just sewing people up, patching them, shipping them to a place for the treatment. That was my first
So you're always running into the burning building?
I always do. There is a war right now going on in Israel. I already wrote my name in as a volunteer. Interestingly enough, I'm volunteer number 39,452 according to the website. So there are a lot of people volunteering for wanting to go into the place.
So that was before Obamacare, right? Physicians were independent. Lots of private practices, I think, were flourishing. So tell me, how has the world changed in that regard?
Oh, gosh, you have no idea. I mean, for one thing, I didn't have to worry about money at the time.
And I don't think you were called a provider then, right?
You were
called a doctor, though.
I was a doctor, and people respected you as such. Mm-hmm. And yes, there were politics in hospitals, like they've always been. But, you have a say in the care of a patient. And then things happen. After Obamacare took over, hospitals needed to make money because, they had some cuts. They needed to, and for them, what do? They became revolving doors. Get them in, get them out, get them in, get them out. And I saw some hospitals that they had this to a micro point. They would admit a patient, send him to their own LTAC, then to their skilled nursing facility, would wait for 2 or 3 days so that the patient would get off after the days that they pay for. And they would make sure he gets sick and they comes back to the hospital all over again.
The cycle of life.
It was a cycle of life and it was disgusting. And right around that time is when, I said, I'm tired of these big hospitals. I went through my share of politics in hospitals and I said that I was going to take care of patients in smaller hospitals. That's when you and me met at University General Hospital.
Which was a beautiful hospital. It
was a beautiful, boutique hospital, small hospital, where I was able to do what was right for patients, no matter what I needed. I mean, we had a good CEO, a good CFO. Unfortunately, because of the constraints of the system, the hospital went down. So at that point in time, I went over to United Memorial Medical Center, which was a little hospital that cared only for the poorest of the poor in northern Houston. But the good part about it is that when the pandemic hit, and it was time to start improvising and doing things, at least the CEO at the time, he said, Joe, do whatever you have to. Of course, he was very happy because, he got international attention. He got patients from all over that were being flown to us because my mortality rate was 4.4%. The rest of the world was anywhere between 25 and 40%.
That's 6 years ago, right? The world was ending, right? We felt that things were closing.
The world went mad. I mean, if you talk to me about conspiracy theories 6 years ago, I would tell you are crazy. Come on. I believe in Fauci. I believe in, the man says that vaccines are safe and effective. He knows.
Yeah, you had his book, right?
I have his book. I read. We all read his. It was part of it. But you change. I mean, when you say, "Hey, wait a second, there are things here that don't make sense," and you start looking at things, you look at them with a completely different world. And the problem is that it's funny because people don't forgive you for changing your mind. I'll give you an example. I was one of the first ones that got the vaccine. I got the vaccine on national
You
television.
peer pressured me into getting it.
Yeah, I mean, I got everybody to get it. I went on TV everywhere. I was on CNN every other day, or if not daily.
You were a media darling.
I mean, I was going nonstop, just telling people, get the vaccine. Then within 3 to 4 weeks of starting to do that, I start saying, hey, wait, I'm getting patients that were vaccinated, and actually they're getting worse than the ones that were not vaccinated. And then I start seeing the vaccine side effects. I said, no, I'm changing my tune. Oh my gosh. The day I changed my tune, the people that said that I was a wonderful doctor in the world.
Were you did you feel like you were canceled?
I was canceled to the point that even the Houston Chronicle that used to feature me every week.
Because I think you had Joe Varon Day, right?
Yeah,
you were given a key to the city.
I mean, I have, the mayor of the city has a day, September 25th is my day, the Dr. Joseph Varon's day. I mean, a lot of people tell me got a great accolades. So the moment I said, guys, these vaccinations are probably not the right thing to do, Houston Chronicle puts a whole page thing, oh, Varon is the worst, he's the leader of a cult or something like that. I mean, it's like, come on, guys. I'm the same guy. I just think that as a clinician, you have the right to change your mind, like lawyers, if new evidence is presented. Sure. Well, we are learning things every day.
So would you change anything differently? Would you not get the vaccine?
Today, if I could go back in time, I would not vaccinate a single person.
Even the older people?
Even the older people, and even because I don't think it made a difference. I personally don't think that it made a difference. And when you look at the number of people that got in trouble with it, it's what I tell people today. I'm seeing the real pandemic. The pandemic is not what we saw before.
Tell me more. What do you mean?
Well, when you go to my practice and you see that more than 50% of what I see in my practice now is vaccine-related injuries, you know that there is an issue. There is a post-vaccine syndrome.
Yeah.
I mean, people don't want to accept it.
Is that correlated to the number of boosts or?
I've seen people with one. I've seen people with multiple. Obviously, the more boosts, the more you get in trouble. But COVID, the whole COVID itself was a political illness. It's an illness that where common sense was not common anymore.
Yeah.
Where doctors did not think anymore. They were told what to do. And they were very good at doing it. Very, very good. I mean, when Fauci said, remdesivir is the greatest drug on earth I tried it. And, the first couple of patients I tried on didn't do well. I said, I'm not trying this thing anymore. I mean, I believe that everything deserves to be tried on. But even today, I have patients that have gone to the hospital with COVID, not my patients, but, have come to me. Even today, they give them remdesivir. I said, come on, remdesivir. And just because they tested positive for COVID.
What about Paxlovid?
Okay, that's a great question. So, I'm not a fan of Paxlovid.
Because of the rebound?
Because of the rebound, that's one thing. And also because of the 450 different drug-drug interactions that it has. And I can tell you that most doctors don't go and look at drug-drug interactions. So I don't use Paxlovid. I mean, we still have good old ivermectin.
Before this crisis, did you know about, you knew about ivermectin, but did it even resonate?
Never. I mean, it was ivermectin for parasites and that's it. And I knew that Professor Omura and Campbell had won the Nobel Prize in 2015 remotely, and that's it. Now, 2 weeks ago, I was with Professor Omura in Japan, and it was...
and how was he?
Oh my gosh, he's the nicest guy on earth. You have no idea. Humble. He's a guy that all the royalties from discovering the ivermectin have gone into either a medical school or hospitals for poor people. I mean, he's a real doctor. He's 92, 93 years of age.
Is he still practicing?
He goes every day to his office. He has his little assistants, and they show me their lab. They show me how they make ivermectin. I was like in Candyland if I was a kid. What
does he think about its effectiveness in COVID and other diseases?
He's all for it. And he's fascinated. Of course, that one of the big ones that we're looking into is malignancies. We're looking into cancer. And I actually shared with him some pictures of some of my patients that have had cancer on PET scan and then what happens after we give them ivermectin and, how this thing goes away. And I tell him, look, I know they're on ivermectin. I don't know if it's ivermectin that does it, but this is what the imaging show. So
You think the new clinical trials will prove it?
absolutely. And, I've talked about this with J.E. Baitachara, who runs the NIH, and he's a big ivermectin guy. And I truly think we're going to see something.
What are the trials now? Do you know?
They're not, most of the trials are...
They're combination with chemo,
are
right?
combinations with chemo. And I'll tell you, for example, today I had like 5 patients that came to the office asking for ivermectin for cancer. I said, look, the first thing that I'm telling you is this, I cannot tell you today that it cures cancer. If you want, I'll be happy to work with you in combination with your oncologist who says, well, but I go to MD Anderson and they told me if I take ivermectin, they're going to not treat me. And they have been told that.
Yeah.
They get fired as patients, which,
I think that's unethical.
yeah, when you and me, we have fired patients, it's because there's somebody making noise in your office.
There's a reason.
There's a reason.
Yeah.
Ivermectin is such a clean agent. It's been given close to 4 billion times in the world. I consider it safer than an aspirin. I've never seen any of the bad things that people think that can do. I've never seen, fulminant liver failure or anything like that. So,
are there any applications we haven't thought of yet that might be exciting?
I had somebody the other day that came to me because had one of the worst acnes that you can imagine.
Well, it's a topical acne drug, right?
As a topical acne drug, it works like a charm. But I had somebody with Crohn's disease that for whatever reason ended up taking ivermectin for an acute COVID thing. His Crohn's got better. So he started taking, so people, and again, some of these things maybe is how much faith they have on it.
Sure.
And I respect that. I do believe we need to do some tests so that at least we can get that stigma that this is for horses only or stuff like that, which, as you know, Mary Bowden and Paul Marik fought against the CDC and they won that fight.
Good. You worked 750 days in a row, is that right, in the ICU? What was the final number?
715 continuous days, nonstop. And you saw me there, unfortunately, a lot. And yes, it was...
was that the hardest time of your life?
Yes and no. Yes, because physically, I don't know where I got this strength from.
Because you weren't a young man.
Correct. I was not a young man at the time. And remember, 12 years ago, I had a stroke. Even though I play racquetball every day and stuff like that.
Spring chicken.
I'm not somebody. I'm not a 20-year-old or 30-year-old. And the patients that we had were patients that were very sick.
Yeah.
And more importantly, you have the concern of what's going to happen to you and to your loved ones.
Because every day you were risking your life, right?
Every day. Yeah. The first day, I don't know if you know, but the first day that I came home, the very first day I came home, we live in Ireland, and in Ireland, the homes, we lifted the homes. So all the homes are lifted. So I get home, I park my car, my wife sees me from the app, and she says, Joe, take off your clothes. Oh, I said, oh, yes. I was so excited about it. So I said, Sarah, what do you mean take off your clothes? I'm here in the garage. She said, yeah, take off your clothes. I said, this hasn't happened in a long time. So I take off my clothes. She throws in a bag, one of these big plastic black bags, says, put in all your clothes in there. Take it to the washing machine, wash it, go take a shower, and then come and say hi.
So there was no happy date night, I take it?
No happy date night. And the only reason why I didn't keep on working after 715 days is because my daughter, Dariel, got married. So she very much told me, either you come to my wedding or you come to my wedding.
Going.
Yeah.
Any regrets with working that consecutively?
No. I help a lot of people. I couldn't help as many as I wanted to. And I was tired. You saw me tired. I was exhausted. I would come into the hospital at, 5 in the morning or so, and I would stay there until 11 o'clock at night. And then after I got home, I would get phone calls every 10 minutes because it was me. Other doctors don't want it to go in. We have an infectious disease doctor that wanted to come in, but if let's say you need a cardiologist, forget it. So it was very good for me because I became a cardiologist, gastroenterologist, just name it. I mean, whatever needed to be done, we did it. And part of me says, this is what I was made for. Because I was, I had the
Fish in water, yeah.
I had the experience of directing ICUs. That I had. I had the experience of dealing with the critically ill. What I didn't have experience is how do you deal with the staff that is so exhausted. My nurses would cry in the middle of the day because somebody had just died in the unit, and they knew that we have 2 more in the ER coming in a very similar fashion.
How did you motivate them? How did you help them?
We did lots of crazy things. We did a music video. We got them food. We all gained a lot of weight when we were there. Lots of jokes. I mean, I had the unit all colorful and, pictures here, pictures there, and made things fun. Up until the time that HHS came in and started checking on things. So says, you cannot have, like a thank you note from a patient on the wall, and you cannot do this and you cannot do that. And, they basically wanted to strip everything out.
So how did you feel? You gave so much. You were the most amazing doctor. You saved lives, but then I think you were betrayed. You felt that betrayal, I imagine. I mean,
there was betrayal in a variety of ways. So, for example, there was betrayal in the sense of the licensing board. And, I know you're quite familiar with them. But, they called me twice. And the first time I went, they said, why are you giving ivermectin? And I tell them, because it works. And I show them my mortality data. And they couldn't believe it. I said, look, this is it. Okay, so fine, you're fine. And then they call me again for the same thing. Anybody that has gone through the board, they know they treat you like a criminal. I mean, it's not like... so it was not right. So it's interesting because after my second time with the board, 2 of the members of the board, they called me themselves and says, we're sorry. I mean, we didn't know that this was going on. Come on. It's like, they have 200 lawyers there. One of them could not pick up and say, this is wrong. So that was the betrayal. The betrayal that I felt the most was when I changed my mind about vaccines and the Houston Chronicle had a hit piece on me. I mean, I truly felt betrayed because I was the one that let them come in and see what was going on so they could educate people. So that was the part that I said, come on, why is the establishment being like this?
Is that why the IMA, you've been leading that cause just to straighten the record?
No. The IMA started first as the FLCCC. Frontline COVID-19 Critical Care Alliance started out of necessity. It was basically Paul Marik, Pierre Corey, Dr. Meduri, myself at 3 o'clock in the morning calling each other, hey, I did this didn't work. What do you want to try? Meduri told us about the steroids. Paul talked about ivermectin. I mean, we came up with, hey, how much steroids do we have? We came up even with dosing that we were so precise that if you came to the hospital, I did a CAT scan, and I saw how the CAT scan looked. I could tell you the exact dose of prednisone that you would need or Solmedrol or whatever I was using. So after a period of a few weeks, we said, you know what, we need to make this available to everybody. So we created this alliance, and we started to have a weekly webinar that was followed by thousands and thousands and thousands of people. And people started to donate money. So we created a 501c3 corporation and became so powerful that today we have over 12,000 healthcare professionals, over 1 million followers, and we made a spin-off of the 501c3 into a 501c4 or whatever the name is, which is the political action part. So we started to do a lot of things with the current secretary of HHS, Robert Kennedy. Whether you like it or not, the guy cares about what's going on. I mean, he's unique, but he cares to make people healthy. I don't care what anybody says. They may think whatever about his position on vaccines or other things, but the man cares. And the fact that we could have a seat at the table, that to me makes my purpose in life continue. Because, I already fought the COVID. We already did the excitement of intubating two people at the same time or whatever. I mean, that now we're trying to make a difference at a larger level if we can.
So what are two things that you'd love to accomplish with the IMA and RFK?
Well, the one thing that we need to do is make sure that people are healthy again. Simple interventions, sunlight, vitamins, caring for these things.
Sleep, even though you don't sleep.
For those people that need sleep, sleep, no question about that. I mean, they should. I think that's one big thing. The second one is we really need to take some power away from Big Pharma.
Can that be done?
Realistically, I don't know if I'm going to be able to see that in my lifetime.
So you're Don Quixote?
I'm being Don Quixote. I'm trying to be Don Quixote. But there are some things that you have to do because you feel that they are the right things that you have to do. Now, I'm not telling you that Big Pharma is all bad because,
they make some good things.
They make some good things. And, there are some good chemotherapies and there are some good, there are some things that are actually good.
What do you think of the GLPs?
Some GLPs are good. The indiscriminate use of GLPs for things that can be fixed with diet and exercise, that's a different story.
Taking it too far.
The people are taking things too far, and that's why you're seeing side effects.
Yeah.
But if you have a diabetic that is obese, you give them a GLP-1, they work like a charm.
Yeah.
They are completely game changers as compared to our glyburide or glipicides that we used to use.
The sliding scale.
The sliding scales. Yeah. Forget about the insulin for these patients. These are good agents. I'm not saying that they are bad agents, but I do believe that there needs to be transparency. And you need to be transparent in everything, especially in vaccines. You cannot be a Pfizer and come in and say, hey, I'm not going to show you my data for 75 years. That's wrong. That's just plain all wrong. And even for the regular vaccines, and I know that your kids are probably vaccinated. My kids, were vaccinated.
We staggered our vaccines, but
they want to keep on pushing vaccines. No problem. Just do randomized, placebo-controlled trials. There are many populations that will be happy to be part of those. If you talk to the Amish population, they say it will be the placebo. And then see what happens.
Yeah.
And again, people have asked me on a regular basis, what do you think about the, measles vaccine or the whatever vaccine is? I'm very, very open. It's like, I don't have enough information to call it one way or the other. I still keep my kind of an old school things. In my practice, I don't recommend any more for adults. I don't recommend any more vaccines.
What about travel vaccines?
If you go to an area that is an endemic area for yellow fever,
typhoid.
Yeah, depending on where you're going. Mm-hmm. But when people tell me, what about shingles? I said, the other doctor told me about shingles. That's a decision.
Now, wasn't there a recent study? It actually decreases Alzheimer's risk?
Yes, but there are other things that decrease Alzheimer's risk.
What are your favorite things?
My favorite things, to keep your mind occupied.
Have a North Star purpose.
That's
learn a language.
Absolutely. Just do something.
Don't doom scroll.
That's the problem. People are now so hooked into.
Do you think we have the most unhealthy society ever now?
No, we have probably one of the unhealthiest societies in the world.
The United States?
The United States. Like I've told you, for example, in Japan, I was in Japan just
everybody's
last
relatively
week.
Fit, right?
Everybody's fit, and they have over 100,000 people that are more than 100 years of age.
Not just in Okinawa, right?
No. They must be able to do something different. And everybody walks, and guess what? They smoke. They
enjoy some sake.
They do enjoy. Even Professor Omura enjoys his sake. Trust me, I saw that with my own eyes.
Fascinating. So then, do you see a political future? No, you would never stop.
Never. I would never put my
even if you could change the lives of millions of people, because it's a scale thing, right?
The problem is that politics, they come and go.
Yeah,
and you cannot fix politics. And
so, no Surgeon General, no.
I've been offered a lot of really interesting positions in the last few years, and I'm a doctor. I like to take care of patients. I actually love caring for patients. I get annoyed with insurance companies every day But I mean, like today I saw a bunch of patients in the office, and some of them were challenging cases. Like this, I like it. I mean, I don't mind it. Yes, when you get the payment and they pay you cents, and you say, really, might as well don't pay me.
Do you see though your job as work, or do you just see it as fun?
It's interesting that you mentioned that. My cousin Anita, she tells me that I go to work as a hobby. She says, Joe, it's your hobby. Because it costs you to have your office. Because it cost me.
So you're on a negative?
I'm on a negative. I've been on a negative for about 2 years. It's because insurance companies are, I mean, you know where insurance companies are. I was lucky enough that I worked very hard for many years, and I can afford to do that. But having said that, and I also have businesses in other parts, many other things. I do other stuff.
So what would you do if you weren't a doctor?
I don't know. I have never thought about it because I don't see myself doing anything else other than doctoring. I mean, I like doctoring, which is the other thing. You know, a lot of my friends who are already at my age says, Joe, when are you retiring? What the hell is that? The day I retire, I die. I mean, I think you need to keep yourself active. I mean, you've seen it with your dad. I mean, there's no way to retire that man.
What do you think of AI? How's that going to change our lives?
I like it. Yep. Now, contrary to many people, I like it for us that we already went through
We know how to add.
We know how to add fractions. We know how to add fractions. Because I'll give you an example. I have international medical students. I've had them forever. I send them on our group chat, I send them an interesting X-ray. Within 2 seconds, all of them will give me an answer. I said, no way. I mean, these are things that I have not even seen myself. And you know that all of it is ChatGPT or stuff like that. When I use AI, it works great. For example, I did a meta-analysis yesterday on the use of epinephrine in cardiac arrest, looking at 4,000 different papers. Took me 12 minutes from beginning to end. I mean,
how long
that would have taken me 6 months, easy.
Yeah.
But again, you have to know your limitations on AI, and you have to. I think AI in medicine it's fascinating. There are some areas in medicine where people probably should not be doing specialties on those. For example, radiology.
When do you think they'll go fully AI?
I don't think we're going to go fully AI anytime soon. Let me give you an example. I was working on a program. Actually, we did a research study with the intelligence department of Israel, looking at an AI program. You know how Mossad knows exactly who is a terrorist out of 1,000 people. They have algorithms. So using the same algorithm, I would send them a medical query, and then they would go and look at everything on the internet, support groups, whatever, papers, and then they would send me a report that would tell me what is legit, what's not legit, what the data truly shows, what do people show. So it's not just the randomized controlled clinical trials, it's also what the experience of people. Mm-hmm. And then if I use that to modify the care of my patient, they would consider part that of a good algorithm. At the time we were doing that, which was the last 2 to 3 years, it would take about a day or two to get the report, which in many practices is not good enough. They want it right away. The problem when doing things right away is you get a lot of what they call hallucinations, which, AI starts making up stuff. So, but this is...
Which model do you have the most faith in now?
Oh, gosh. I think that any model that you can train yourself...
The right prompts
works. Everything is how you ask the question.
Sure.
In AI.
Premium version?
Premium
Pro version?
Yeah, you have to go pro on all of them. The best one that I like for medicine is Elicit AI. Elicit is amazing. It's unreal of the stuff that you can get there. But, in the lower range, Perplexity works well. And even ChatGPT, if you know how to ask a question.
Yeah.
You just need to know your limitations, and you need to double check everything. Because even in this study that we did, everything had to be reviewed by a human before it came to me. And that was the whole hiccup. So we'll see. We're still working on that study. It's really a cool little study.
What other professions do you think are in trouble medically?
medically, I think that radiology is the number one. I mean, unless you do interventional,
Yes.
a lot of the ones that will be in trouble are unfortunately the ones that are related to primary care. Because if you look at it's like 47% of people before they go to their doctor, now they ask on ChatGPT.
They already know.
They already know.
Yeah.
And they know sometimes more than what the doctor knows.
So it's becoming democratized, right?
It is.
Yeah.
And it's a shame. I mean, it's funny because my patients come to me with their ChatGPT query.
They just ask for the prescription.
And some of them have asked for a prescription and says, wait, let's talk. And just to make sure that I like AI. I mean, to me, it's cool. I actually have my own avatar, and I've been working in creating a hologram and stuff like that, so that I can get me to be asking questions to patients in different places. But that's just because I like technology.
You think we'll have a Tesla robot working with us?
Yes.
Yeah.
It's a matter of time.
5 years?
They're moving fast. I mean, I don't know if you've seen the little doggies that they have.
Very impressive.
It's
and
impressive.
I think the Chinese robots are pretty amazing.
They're impressive. And China now has even the soldiers that have a robot soldier. So I think it's going to happen. I think that within the next 10 years, we will be having some kind of assistance.
Elon Musk said that in 10 years, forget about retirement. Don't squirrel away your money because we'll have everything abundant. Do you believe in that?
I don't know. Sometimes I think that Elon Musk really is a very positive guy that thinks that everything will be available. No, I think that people will need to continue to work, will need to continue to produce, and that production is going to be dependent on what the world order looks like. The way politics are.
It's a bumpy time now, right?
It's a bumpy time. I mean, everywhere in the world. It's not just the U.S. Everywhere, no matter where you go.
You think we'll be okay?
Yes, absolutely.
You have faith in humanity?
I mean, throughout the history of mankind, we have gone through the ugly, through the bad, through the, all the terrible things, and we have survived. We are going to survive. In what shape, way, or form, that's a different story.
So knowing now all these things, if you were 20 years old or 18 years old in Mexico, right, where would you go? Well, because being a doctor now seems like...
I know, in my case, I would probably do everything
exactly
the same. And I would have done, my medical school in Mexico because I did a lot of hands there and I was able to do... I mean, I delivered more babies than most obstetricians have delivered before they go out in practice here. I mean, it's... I would do everything exactly the same. I would continue to make even the same, call them mistakes that I have made, and I have continued to be as vocal as I am. Because if not, I wouldn't be who I am.
Even in the personal life?
I mean, you learn from your mistakes.
Yeah.
I mean, yes, you go back in time and you tell, hey, Joe, don't do this. Well, it's a little too late. It's not going to happen. What I can do now is just tell other people not to make a mistake. I already made it. So I'm also realistic, even though I love the idea of time travel.
Where would you time travel?
If I could time travel to, gosh, man, all over.
Who would you have dinner with if you could go into the past?
Oh, first person?
One person, but you can give me three.
I'll give you the first one. Hugh Hefner. I never got the opportunity to meet him. I wanted to meet that one. I have to be honest, Hugh Hefner would be one person I wanted to meet. Sir Winston Churchill. I really would have loved to meet him.
He had an interesting routine.
Very interesting.
Right? Bathtub and...
I mean, he was... And, he had his depression episodes. And I would love to meet him. And believe it or not, Abraham Lincoln. Abraham Lincoln, fascinating. I actually wrote a little bit... One of the things that I like to write is a little bit about history of medicine.
Yeah.
So I wrote the medical issues that he had when they shot him, how when he gets shot, how they take him to the place next to the theater and his vital signs and the whole thing. I mean, I have a whole history.
So would he have made it today?
Well, when President Abraham Lincoln had his shot, he had a cardiac arrest. And his doctor, Charles Augustus Leal, who was he was sitting next to him during the shot, he provided him with what we now call modern CPR. He said when the president did not breathe, I thought about the other mode of death, apnea. And I started my resuscitation attempts on him by providing him with artificial ventilation. And he tells you that he got 2 assistants, one on each side, to move the arms like this, so that his thorax would move up and down and air would go down. And then he started to push with a thumb on the chest, giving him truly
CPR was born.
Yeah, I mean, he opened his airway. He said he felt the paralyzed tongue of him. I mean, it's a whole fascinating thing. And it's funny because people says, well, CPR was discovered by, a few guys in the 1960s. It's like, no, guys, CPR, we go way back. I mean, so it's one of my hobbies.
What about your hypothermia, your other protocols you've done? Which one are you so proud of?
I'm still very proud of hypothermia. I mean, hypothermia, I don't care, what the new studies have shown. I mean, just like what they say about ivermectin in COVID. I've seen it work. You don't need to, I don't need it.
Do you do cool plunges?
I don't, but I've been doing a lot of reading on sauna, followed by the cold plunges. And actually, we have a paper coming out on the physiological benefits of
I think the Finns did a beautiful analysis. All mortality went down, right?
Well, we have a nicer study coming out, hopefully in the next couple of months. I mean,
what group of people?
For everybody. For everybody. No, we are doing. It's a meta-analysis of everything that has previously been done.
So what's the dose of sauna that we should do? 3
times a week, minimum 15 minutes. A temperature as high as you can get it.
Dry sauna?
Dry sauna, near infrared or infrared saunas are probably the best ones. If you can get it to more than 160 degrees Fahrenheit, 180 is ideal. It's what you need to do.
What do you think of the longevity now? How long do you think we'll be?
Well, it depends on who you talk to. If you talk to Putin and President Xi, you will say that they think that we can make it to 150 years.
Yeah, they have some secret things probably.
Yeah, they have one of the things that they've done in China is they are doing a lot of organ transplants. And
it's a bit of an ethical dilemma, right?
Yeah, I mean, there is a whole thing. Yeah. Jan Jekielek just published a book called Kill to Order, and that's his studies of 20 years of people that, and everything actually started out of him talking to a guy that was running a transplant service in Israel. And transplants in Israel are minimal because Israelis don't allow transplantation because of religious reasons. And apparently this guy who ran the transplant had a patient that needed a heart transplant. And the patient told him, I'll be back. I'm going to China to get my heart transplant in 2 weeks. And he went, got his heart transplant, and got back.
No big deal.
Yes, but he knew when his heart transplant was going to be.
Mm-hmm.
You don't plan.
That's a bit odd. Yeah.
You don't plan a heart transplant. So apparently they have all these political prisoners that they have been pulling their organs from.
Yeah.
It's disgusting.
So how do we change that?
You
can't. It's out of our control.
You can't. There are things that I can control. There are things that I cannot control. So first, control your own health. That's number one. Control the health of those who are around you. And as doctors, try to control the health of our patients as best as we can without letting them lose their freedom of choice, which is one thing that, we have been...
It's a bit scary.
It's a bit scary, but I am very open with my patients. You are my patient. I'm a lung doctor as well. You are my patient. You smoke. I will sit with you and we will have the little discussion of no smoking and stuff like that. But if you decide that you keep on smoking, that's your choice.
Yeah.
I cannot take that away from you. I mean, that's wrong.
So how has vaping changed that? How destructive has that been on the lungs comparatively?
It's bad.
It's worse?
It's probably worse. And it's probably worse because people think that it's more benign, and it's not. And, I saw a kid the other day with early stages of emphysema who was doing 1,500 puffs, like one of these vape thingies.
The dragon.
Like the 1,500 puffs a day. I mean, people will have these little things in their bed, and then in the middle of the night, they wake up and they puff it. it's changing. So just, again, those are things that I discuss with them. I tell them, this is what's going to happen. I show them graphs. This is what your lungs are going to look like. But the decision to quit is yours.
What do you think of nicotine as substance itself?
Absolutely amazing. I mean, for patients with long COVID, oh gosh, it's amazing. Some really interesting data.
Gum or
patches. You put a patch. Kids with autism. I've been looking a lot of at for whatever reason, they keep on circling down my way. Autism. The patches. You put a patch on an autistic kid, and they start acting better. Very interesting. Again, what I want the science to back up those observations, which is what we do in medicine. You try something, it works or doesn't work. No way around it.
Are we going to see those trials?
If we continue to have the current administration, I think that we're going to see a lot of those trials. If the Republicans lose the midterms, I think that that's the end of the NIH as we know it today, the CDC, and definitely RFK.
What else longevity-wise? Rapamycin, sirolimus?
I mean, all of those things work. Simple little things.
Do you take it?
Turmeric. I do turmeric. I do dandelion, which I believe works well.
Vandelion?
Dandelion.
Dandelion root.
Dandelion root, which has also been used for malignancies, as you well know. Yeah. I mean, I think that those work. Beetroot, amazing. Beet, plain old beet. It also decreases your blood pressure because it does that. There's actually some interesting data on metformin. Metformin is coming back, and it's coming back as a longevity agent. So,
right, it targets the AMPK pathway. Correct. Right.
And it's interesting that, now we are doing actually one of the things that we're doing, and I'm the editor-in-chief of the Journal of the Independent Medicine. We have a whole issue that we're going to do just on repurposed drugs, because there are so many repurposed drugs that...
With the help of AI, too.
Yeah,
right?
which is, nowadays you can find so many. It's amazing. Now, remember, AI is dependent on
the prompt.
Who owns who owns the data. If you do an AI, it's so funny because I do an AI on ivermectin on regular basis, just to see how it responds. And, they usually say there is no data that it works for COVID or whatever and stuff like that. But if you change the prompt and says, show me clinical experiences of ivermectin, it's like, ivermectin is a great drug, stuff like that. So it depends on who's entering the question.
When do you think we'll be able to produce organs?
They are already producing organs. I mean, there are places all over.
But the big ones, right?
I mean, they have the little mini kidney that was produced in Israel, and then China also did
but it's not
something. It's not
prime time, right?
I mean, it's going to take time. I remember when I was doing my fellowship, we were doing an artificial liver at Methodist. And everybody was excited about it because this was going to be like a dialysis, but which was completed with liver cells. And it was super cool. I was excited about it, and it went down. So I think we are still away.
20 years out?
I mean, as long as we don't go to the unethical thing, which would be the cloning. Let me clone you so you have your whole set of new organs in case that you need it. I think that we're at least 20 years from full organ development.
Interesting. So for the medical students, for the young physicians, what would you tell them to make the best out of their life now, entering the field, seeing what we know? Well,
you need to decide why you are going into medicine for. I mean, every student that I see today, they are in for the wrong reason.
Which is?
Money.
Yeah.
I'm not telling you starve to death. But I think what I'm telling medical students is if you do the right thing, money will come to you, even though, like I said, my office has been in negative for the last 2 years.
We have to change that.
I mean, but that's because of insurance plans. It has nothing to do.
Yeah.
Patients, I have tons of patients.
The same thing is happening to my brother-in-law. He's a family practice doc in Oklahoma. He was doing quite well. He sees 100 patients a day.
Yeah.
Now he's thinking, what is he going to do, right?
Yeah, but we just have to reinvent ourselves. And as long as you love what you're doing, I mean, don't they say that if you like what you do, you don't have to work a single day of your life?
Exactly.
And that's what these kids need to understand. A lot of them go now oh, I want lifestyle and I want this. Let me tell you, a few years ago, I had I was interviewing somebody to join me in practice. So I interviewed this young girl. She's fresh out of fellowship, literally the day after fellowship. I said, and what are you looking for? She looks at me and says, well, I want to make about $400,000 a year coming out of school training. So I look at her and I said, and then I do the math and I said, gosh, I mean, if she works hard, I says, well, if you work really hard, I think you can do that, but you're going to have to work really, really hard. Yes. She says, oh, yes, perfect. And I want to be on call every 8 weekends. So I look at her and I said, look, sweetie, it's 2 of us. That's not how this works. But that's what they're looking for. They're looking for lifestyle.
Yeah.
So they get to be part of these giant organizations, hospitals that buy them, and they lose their soul.
Yeah.
Because they do what the hospital tells them to do, no matter whether it's positive, negative, whether it's going to be good for a patient, bad for a patient. They do what's good for the hospital so that they can get their money, and then they can be on call every 8 weekends.
Well, I had a great time talking.
Thank
Keep
you.
doing what you do, and
thank you for the
let's
invite.
make the world a better place. Huh?
Absolutely, we will. I mean, and with your voice coming out in channels like this, I think we can do it.